Hello everyone. So this is the part second of heat related illness and we are going to talk about heat stroke or Lu. So starting with what actually occurs in heat stroke, we'll try. Already we have understood the pathophysiology behind the hypothermia that also applies for the heat stroke, and we will try to understand what are the symptoms that are seen in heat stroke that help in identify such a case. So the cardinal signs that are seen in heat stroke are CNS dysfunction, dry and hot skin, and hyperpyrexia. These are the cardinal signs which a patient presents with. Generally, before these cardinal signs, the patient has heat exhaustion, and during the phase of heat exhaustion, person generally sweats and he has mydriasis. But as heat exhaustion passes and it transforms into heat stroke, the eyes go into meiosis and we have a dry and hot skin. Now let's try to understand why these features are occurring. CNS dysfunction presents a irritability and irrational behavior of a person with delirium. Now the cause for this is the heat itself causes damage to the nerve fibers, leading to CNS dysfunction, and also because of the metabolic processes and toxins being generated, inflammatory cytokines, there is CNS dysfunction. The second feature is dry and hot skin. Dry because the hypothalamus has lost its thermoregulatory control and no more sweating is occurring. And already there is hyperpyrexia that is going on. The person also has meiosis. So these are the cardinal signs which help in identifying a patient of heat stroke. Let's try to understand further what are the other symptoms and signs seen in a patient of heat stroke. Starting with heart, the patient has tachycardia. This is because there is increased metabolic processing and increased oxygen consumption. Along with tachycardia, there is dysrhythmia. The heat itself causes damage to the myocyte directly, leading to myocardial infarction, and this will lead to myocardial pump failure. The third thing is lung go into extreme tachypnea, more than 60 rate per minute. This is because the metabolic processes and oxygen consumption of our body is very high, and body need to compensate for that, so lung go into extreme tachypnea. Due to inflammatory cytokines, there is endothelial injury. This endothelial injury makes the patient prone to ARDS, that is acute respiratory distress syndrome. A patient of acute respiratory distress syndrome has pulmonary edema, and we observe on examination the patient has crackles and cyanosis. Talking about the renal symptoms, because of heat itself there is damage to kidney, and rhabdomyolysis, the electrolyte release, damage the kidney. This leads to acute renal failure. Further talking about the intestine, because there was decrease in splanchnic circulation to provide the blood to the peripheries so that there can be heat dissipation, the intestine can go ischemia, and also there is direct hepatic damage because of decreased circulation to the liver. Talking about the metabolic changes that occur in the body, because of dehydration there is increase in urea and creatinine in the body, plus the blood starts to concentrate, that is hemoconcentration. Because in initial phase when the patient had heat exhaustion, there was sweating. This sweating led to decrease in sodium, potassium, and magnesium. But actually we need to know that the potassium decrease inhibits the sweating, and this is what is exacerbating the condition of heat stroke. The final thing we need to remember is that is bit contradictory, that the heat stroke itself leads to DIC and it also leads to bleeding. Let's try to understand how. There was endothelial injury in the case of heat stroke. So this endothelial injury can activate the coagulation pathway and lead to DIC. Now how anemia and bleeding can occur? The heat itself causes deactivation of the clotting factors as well as the platelet, and this is how bleeding occurs, following which anemia can occur. So these were some classical features that are seen in the case of heat stroke, including the triad, the heart showing tachycardia and dysrhythmia with myocardial pump failure, lung showing tachypnea that is extreme, ARDS with a feature of pulmonary edema, crackles and cyanosis. We had acute renal failure, the intestine were in ischemia with ulceration, and metabolic processes showed increase in urea and creatinine with a decrease in sodium, potassium and magnesium. Potassium decreased lead to decreased sweating. There was DIC, anemia and bleeding. So these are the feature we need to note about heat stroke. Let's talk about its management now.